And then after that, what are you doing? Belly time or variant? Belly time. Miserable. Sorry.
Go right
Can you give me a couple of those?
Okay. Large? Medium?
Alejandra, can you put on the recorder?
Already, but thank you.
So, what's the most recent dressings you've been doing?
Say that again?
The most recent dressing stuff?
All of them?
Wound vac dressings we do 3 times a week.
Wound
I
vac.
measure once, Genadine, wound vac. I do the dressing every Friday. And Alejandra does the other 2.
And we had silver loin in there.
We have another opening that we
It's closed now.
That's close, huh?
The one on the lateral.
Well done.
Close from the side, huh?
Yeah, it did.
How much vac sponge can you get in there?
You know, my orders originally said not to shove more than like 5 or 6 centimeters in there, but it goes, you know, between 6 centimeters and 9 centimeters, between 6 and 8, depending on his position.
But lately it's been pushing the tail out
You know
because
what?
there's not a lot of space.
This is better than it was before
Yeah.
in terms of how undermined it is.
It's been a year though.
Because I recall it being undermined like my whole hand, and now there's just a tunnel.
Mhm.
Oh, that's cool.
That's awesome. That's way cool. That's the best thing that could possibly happen.
There's a few caves.
6 or 7.
But at least you
Little
can
appendages,
like
really.
feel them,
Yeah, before it was everywhere.
So like
Yeah.
an open cavity,
One of the things that I'm kind of concerned about is if it's closing on the top and then but not on the bottom. So you know what I'm saying? Like it closes on the roof.
Well, you don't have to be concerned about that for long, because if that happens, you'll get a great big red abscess and I'll have to open it up right away.
Oh.
So that if that does happen, then that means surgery. So I would say all things considered, that's 6.
And we've been going every other week with Patty to do the rest.
I think that's making a big
I
difference.
think so.
Do you?
I do.
I think it was 10 when we started.
Now that he's going
Let me see what
regularly,
my old note
I
said.
think it's...
I'm just
The
curious.
original one was 12.
It was huge.
12.
Yeah.
So if it's 6, that's a 50% reduction. I mean, that's slow going, but at least it's going.
Yeah.
John, what are you eating?
Lots of protein.
Yeah. Oh, they're more potent because Alejandra makes me these protein shakes and they're real good. They're real tasty.
Okay.
And I'm also eating, tuna and ham and Mom makes me meatballs and all. But then I also get some vegetables in there, like some mixed vegetables, green beans.
Okay.
Corn.
There's one behind
It
you.
sounds like all the right stuff to me.
Yeah. He's eating good and he hasn't lost his appetite.
Yeah.
Okay.
He's a good eater. And his weight is staying put. He hasn't gained weight, but he's staying on it.
144
Mhm.
pounds or something.
And at one point they were concerned that maybe he didn't have enough weight, but the blood work came normal. He's not overeating protein, but he's not, what is it called?
I can't think of the word.
Yeah. Anemic. He's not anemic. He's good.
Good.
Everything's good.
He's not nourished.
But he's not malnourished. He's not anemic. Yeah.
Well, we're basically at the same place that we were before, only now we have some good news. My feeling is that this may never close on its own, but if it's getting better, it might. It's a long shot to see them close all the way, but it does happen. It's all just how much can you take care of it, how much can you not sit in your chair to let it happen. If it stalls at some point, we may want to consider opening it up. But the issue that happens once you surgically start managing these wounds, then they can go from something that's sort of open and stable to something that's open and bad. By the same token, they can go from something that's open to something that's closed, and you don't have to worry about it anymore. In your case, you're so darn skinny that you don't have a lot of great options in terms of, borrowing tissue from here or there to rotate in. If we can get this down to something that's, just barely undermined and littler, then I can just go in there, cut it out and close it. And that's a cool thing. Yours, it's right on the cusp of being able to do that now. Sometimes we go in there and then everything's bigger than I thought it was, and I make a bigger defect, and then I have to borrow tissue from somewhere else to get it closed. And that, the bottom line is the best tissue on your body right now for your bottom is on your bottom already. So anything that I move won't be quite as good as what's there already. So, if it's not making you sick and it's getting better, I would say stay the course. If you're totally sick of dealing with it and you want to take a leap of faith and a chance, then I can operate on it.
Yeah, I have to talk to my wife, but I feel like it's extremely slow process, but it is moving in the correct direction, I hope, and that's what it sounds like from listening to all you guys, so,
Because we're getting about a half centimeter of closure a month at this point, which is actually pretty good for for a decubitus when you're sitting on it a portion of the day. So one of my other doctors a long time ago, a year ago, whenever he cut this, he said that he said that you should sit on it for a certain amount of time just to push the sides together, but I don't know what you think about that.
I would like to know who that is.
I would call that
I
the
would wanna talk
absolute
to him.
stupidest thing I've ever heard.
No,
Okay.
you shouldn't sit
You
on
could,
it.
sitting on it, with the weight of your body and your inability to sense the way that is distributed, it just shuts down all the little capillaries that bring nutrients in that allow wounds to heal.
Yeah.
It shuts it down, and then it can allow necrosis to occur by
Wow.
keeping it out of there, for an X amount of time. So sitting on it doesn't help it.
But it's a good thing he didn't follow that advice. He
Yeah.
stays up belly
Now,
down a lot.
what about
It's
the
an awful way to live.
hydrotherapy?
It's totally, I think that's fine. I think that's fine. It's an awful way to live on your stomach,
In
And
addition
so I
to
would
silver.
just say that you have to find that balance.
Instead of-
You still have a life that you enjoy, get out. Is this the state-of-the-art cushion? Is this the best cushion money
Yeah,
can buy?
yeah,
Okay.
yeah.
It's just one of those.
Considering to what he's gone through, he's gone to different ones, and this is the one that has done less breakdown.
Yeah, okay, I just wanna make
Yeah.
note, and they wear out, they can make their own pressure points, that's, you gotta be vigilant with that if you're spending
And
3 hours in your chair a day.
have you been over to see Maggie for a seat of?
It's good because he's always laying on his bed. He never goes outside. Never
You
lays
should
on
totally do that, and that should be done a couple times a year.
He doesn't get ulcers on it.
No, he's good.
The
Need a
seat
mattress
valve
with
over with
air
Maggie, the occupational
Yep.
therapist, the blood pressure valve, have you been over to see her?
His only pressure point is
Yeah,
that one in the
Well,
back
the
and that
cushion's
heel.
change,
Yeah.
the cushion's change,
And
so,
she gets,
you sit on a little, just like an old chair, they get lumpy, so you gotta be vigilant, you gotta always be on, especially when there's a wound. I think it's hopeful, I honestly don't have a crystal ball and I can't tell you which way it's gonna go, but if it's not making you sick and you're tolerating the wound care, then, it's heading in the right direction.
Well, one thing one thing that I wanted to tell you is that, I've had a burning sensation somewhat in my ass feels like it's on fire, for about 20 years, and, if I'm really, and I think that has to do with hip bursitis, somehow, because whenever, now that it is, because we've seen some improvements lately, that,
your chair too long, you should definitely pay attention to those. I mean, that's a gift if you can, if you can interpret those signs. That's a really good thing, because that'll keep you out of trouble down the road. So, yeah, I don't know much about, neuropathic pain and all that. That's for smarter people than me. I just cut and sew. So, I think we're okay. I would keep it status quo unless there's a problem. That would be, if I was you, that's what I would do. That being said, you let me know if it gets to be too much and you want to bite the bullet and try surgery. If I think there's a reasonable chance of success, I'll tell you, and we can do it. Right now, I'd give us, 50-50 chance of being able to just go in there and get this closed. So I'm not really wild about those odds.
Okay.
And as far as infection, doctor, Patty had said there's probably likely always going to be a localized infection at the site, but not to worry unless you develop signs or symptoms like a fever.
That's exactly right. Your wound is now colonized by bacteria, and those bacteria aren't making you sick, and that's good. You want them to keep living in there until the wound closes. So,
yeah.
That's
where the smell comes from, right?
That's exactly right. That's exactly right. And there's nothing you can do to get rid of it, because you get rid of them, and they're going to move right back in. So just be happy the ones you have don't make you sick, and keep the wound clean.
It's hard to tell I would probably feel like crap because I don't really get a sick, I don't get a tummy ache or, I don't get fevers.
No, you do get fevers.
And you'll see red, around the wound.
Had infections.
You do not have an ostomy, right? You do not. And but the stooling isn't a problem with this wound. It's from
He's never good. Have never been a problem.
Okay. So that's an awesome thing too. No one wants an ostomy. So.
Yeah, that would be nice. That's good.
Daily regular bowel movement.
Yeah.
So we'll see. What questions do you have for me? Any?
I hit you with pretty much all the questions that I got.
My question, Dr. Larson, is we want to see him again in 6 months to see how he's going?
I'll see you as often as you want to see me. And Patty is a great resource. She'll know when it's time. So, but you want to come once a week? I'm here. Good to see you, my friend. Happy holidays.
Thank you, Dr. Larson.
You're
Appreciate it.
Yeah, so I think that broken stuff is definitely a good touch.
Just write a script, that's what she needs, and we'll put it in.
Is
Or
it
do you
in
want
the
to put it
system,
in?
do you know?
I believe it is in the
What's the
system.
list?
I don't look for it.
The label.
And I would prefer, since there is such a space, there's 4x4 sponge. That's what I think would be the best choice, because they can cut it.
Well, let's see what we got there. I think beggars can't be choosers in this new system. Even here, we'll see.
And if not, what I have to do is, I still do paper and fax it to the supply house.
Are you shocked to realize that it's not in there?
I actually think this will be, but no, it's not in there? Oh, you gotta go under wound first.
What?
I think, well, you gotta go under wound care or supplies or something, it's really hard to get to. There you go. Maybe I'll try.
I agree with you, but we should just let it be for a little longer. It says moving slow, but it's moving.
Okay.
Wound care.
And I don't want you to lose your other abs.
It gives you ability to write.
No.
And then,
It's okay.
click to anything.
Yeah, he told us one from the abs or from the arm. This.
Is it BID or daily?
No, it's with the back change, so it's really 3 days.
Monday, Wednesday, Friday.
Yeah, Monday, Wednesday, Friday.
Dr. Larson, you can't grab from one of my legs, could you? If
No,
there
because
was
they're too skinny, puppy.
Well, I can, and that would be probably the first thing I would do is I do something called a V to Y advancement of your hamstring tissue. But you're pretty skinny, and so you actually do have a little bit of padding in your gluteal tissues that you don't even have on the back of your legs. So, anything I move isn't going to be quite as good as what you had and broke down already. So that's a setup for failure. So if I can just get what you have closed, then that's a good thing, but it's not quite there yet. if we need to do it in an emergency, yeah, that's what I'll do. But the problem is it's just not very durable. Once we start doing those things, then it's, you know, it's sort of a gradual downhill course of, you know, that one failed, now we gotta do something more complicated, yada, 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 and then it's better just really take care of yourself and avoid it.
Okay.
Avoid going that far.
Did you still want to place over there, or do you want to do the
I
thing
can do
here?
it right here.
Mhm.
Let me go talk, get a curette, and we'll do it right now. I'm sorry. Thank you
Awesome.
for
No, no, no.
asking me. Give me a minute.
That frees your day a little.
Do that to me too.
Yeah. No way, she has a little freedom because she's so busy over there. It's crazy. Maybe I'm gonna check if you had enough here.
Alright.
Nope. Just
Happy
that.
holidays, you guys. I'll see you soon, okay?
Thank you, Doctor. I appreciate it.
Sure, my pleasure.
Yeah, that was very good to hear, right? Yeah. That was my feeling, but it's good to hear it confirmed.
Yeah, I felt like, lately I've been feeling like we're seeing more serous sanguineous drainage.
Mhm.
You know, there was some concern because of the
The
odor,
smell,
but like you
yeah.
said, that's, we're not gonna get rid of that, but if it's staying localized, if he's not presenting with symptoms or fever,
No,
so
no fevers.
I don't have to worry as long as it stays right there.
And he doesn't notice himself, but I always check
You
him.
do.
Yeah, it's like,
I think they say, you know, a fever change in mental status, just that's how a lot of spouses tell, they're like, you know, it just wasn't quite himself. You know,
yeah,
I have so many
totally.
wives tell me
He
that.
gets so cranky when he's sick.
Yeah.
And he's usually so mellow and sweet, and you're like, there's something wrong. So you go, okay, what's going on? Yeah.
Spouses always have that like sixth sense.
Yeah.
Thank
Like
you for coming.
just fit on this table, John.
Just barely, yeah, please come
No,
in.
usually, I don't go over to the main campus. I do them over at my, thank you.
No problem.
I was gotten all
We
excited.
didn't know if you
Oh my
needed the
God,
stickers
I
or not, so we left them there.
Good.
No, I'm so glad your wife is on it, John.
She was that to me too.
I'm so thankful.
No problem.
Thank you, Debbie, for coming.
Oh, you got well, thanks for telling me about it.
What we're doing is trying to basically abrade the wound, because wounds get, and bone included, when they're exposed, will get kind of a film over them, and it will begin to scar, but in a different fashion. And so really, I would love to use what's called a curette, but I don't usually have it either. And so really what I do is just rough it up. I'm really just, I know. Thankfully, it doesn't feel this.
Yeah.
But it just antagonizes the tissue. And for my folks who do feel it, I use a lidocaine ointment, because you have to get all the grunge out of the wound. All that film and all that bioburden and all the junk that's growing in there will like cause the wound to kind of almost seal closed.
So how do you know how much to do?
I guess practice. I did it on one open wound that I could see. So when Mr. Bueller came to me, I just kind of
No.
It's a challenge.
I thought, what did Dr. Larson do to me? But I just, I did it, and we started working on it, and it's getting better, which is, and then, because I don't, you know, sometimes they've got plans, or his wife takes wonderful care of him.
I know,
And so,
she practically did everything.
so she'll say to me, no, just put a little in. And so what I do now is I just put either an iodoform or, you know, I have some alginate that Aquacell.
Oh, I
And
have
do you use
Aquacell.
hydrofiber? Do you have the hydrofiber kind?
It's like a silver looking one?
Yeah, it's skinny? Yeah, I love one of those. Comes in a silver wrap. I didn't even think to bring it, I'm sorry. I got so excited over there, I was gonna get out the door. Cause you know
Right,
how
you
I
can
am.
make it, they're
All of
gonna
a
pull
sudden,
you back.
everybody's calling me, Patty, so-and-so's here. I'm like, no, I'm going to.
I
Today is my first day back from vacation. Woo-hoo. I went to North Carolina and saw that grandbaby, and so it's been, it's been a little bit, nobody knows I'm in the building yet. So it's been a little slow, which is wonderful. Give me a chance to acclimate again.
I heard they have really good barbecue over there in North Carolina.
They do.
They do?
Yeah, it was so cold though, and I went to play with my grandson who turned 2 yesterday. So we just, he is, oh baby, we just hung out. Yes, and so when I have him, I usually just stick this in because it will help wick away all the gunk I just activated in here. And then the silver has the antibacterial. And then they go home and either Miss Bueller or Deb will come and put the other back on. But they will need, I think, a printed version of that order that Doc just put in for Hydrogel Blue, so that Debbie can order it for his home health, and we're going to try that. I'll show you what I'm talking about. Hydrogel
Does
Blue
it
is
still go through you guys or through the other company?
If I have a copy, I can contact it.
Okay.
Hydrogel Blue is another dressing that they took old gentian violet and Hydrogel Blue, which are old dyes that we used to use to sterilize things, and they came up with a configuration that doesn't. The original dyes we used to paint with, and then I usually take that down so it doesn't mix in there. Anything that goes in got to come out.
Not with me. There are phone. But I have my phone. The phone number. Does that help?
He comes to see me every couple weeks over the years to help fix the best. And then we just put everything on top of it.
I got 480 835 9100. Melinda is in charge of wound care.
And you know, when I'm using that blue tape in the clinic,
And they're called Med One, actually.
Bueller actually does really amazing with tape, and I haven't not yet killed him with it, which I'm thankful for.
Do you have any skin prep?
Yeah, the skin prep helps the skin not break down like the adhesive skin protectant. Do you have any?
The spray?
Yeah,
The spray is
that'd be
perfect. Yeah.
Do you have any other cloth tape?
Like the microfiber?
Microfiber, yeah.
Yes.
Awesome. Whoa, all kinds of goodies.
So is it snowing over there?
In North Carolina?
I got stuck in Baltimore. I'd never been to Baltimore before. I don't think I'm going to fly through there again. I'm going to go to North Carolina.
So you were
There were 6
impressed.
inches. They had to clear the runway to get the plane into the, and then they wouldn't let us leave. So I just spent the night. So,
Yeah.
Wow.
yeah. Thinking I'm going to spray. And this is like a silicone polymer kind of product that helps just keep the skin from being torn when you pull the tape off. So for folks who are, you know, have lots of tape stuck to them, it helps to protect it. It comes in wipes also. Water now. Yeah, one more piece. Have to take close information.
Actually, one more piece, but
One more
it's
piece
right here.
here.
Because with the pants, she's gonna bring it down.
Oh, she's a pro, let me tell you.
Thank you, thank you, thank you.
Oh, tell me, come look at it. Okay, you're down, okay?
Yeah, you got it.
All right. That's it?
That way we can make it home. Okay, babe, you can put your pants up whenever you feel like.
Hydrochlor blue. And, did you get done doing this home health first?
Yes.
You print that one and give it to her, then she can help it, and I'll show you what that is. Here, I'm gonna give you this. I'm gonna show them what this is, and then you can use these for triple. They're too skinny. Oh, here's the thing with hydrochlor blue. Let me show you more right here. I'd love to open it and play with it, but here's sponges. This is made of sponge sponge material, that's why you can use it at the back. And it's the same as white sponge that KCI uses, so when you use it, you gotta get it wet. You gotta get it wet so it's so soft, and then if for some reason it's dry, then you gotta get it wet all the time to clean out. There's 3/4 of the product. But the one I like the best is a square 4x4. And you can
This way,
cut
we're gonna pull down.
so you can even cut and put it in the steel to cut. You know what you cut, you know?
Yep.
I know what you look like, and it should give you enough integrity to go in all these little crevices. And it releases it for the 3 days, so you can leave it in and take it out when you change the dressing. I would still attach a piece of foam to it. Does that make sense? Because white, even white foam by KCI is not gonna suck. You can't put the KCI in it. You gotta have that black foam to give it the right suction on it. Okay?
All right.
Well, so you're gonna have to show me how to do that.
Yeah.
Yeah, first.
Well, you know what, I'm just gonna give you one strip, because I don't really want, you start with those and see what happens, but the problem with these is you'd have to put in every little orifice, and I just don't think it's gonna work as well.
Well, the foam only goes in one orifice. We can't put the foam in each one when we put it in there, do you know what I mean?
Yeah.
So then it just, but it still, I think it all sort of gets sucked out.
I think it does, I mean, it's obviously getting better, so it's doing something.
Yeah.
Okay,
Color?
but that's what it is, and the squares come the same way.
Yeah, I don't know how we put this in with the foam.
You know what, you couldn't put it in with the foam. I was thinking, oh, you could put this in with the foam.
Yeah.
You get it soft, and then you take like a pair of those pinchers, hemostats here, and stick it in there. You'd have to cover with the skin protectant and put the foam right at the opening.
Okay.
You'd have
Foam
to
just
use
at the
like,
opening and this, make sure this is touching the foam.
yeah,
Okay.
So that it
that makes
absorbs.
sense?
Mhm.
Yeah,
Okay.
yeah, that's
Okay.
what I'd try it.
All right, we'll just give
Okay.
it a shot.
Okay.
See what happens.
And the thing with this is it's bacterial static, not bactericidal, so it's not going to kill every bacteria in there, it just decreases the load. Because when you start getting odor, you've just got a higher growth of it. But as you said, you're going to get some growth locally, and still, if you're feeling okay, then it's not systemic, it's localized in that area. So we just want to decrease that amount of growth, and that's what this will help us do. Okay? And they get used to whatever we're putting in there. So the back of the silver's been doing it, but now they're used to silver, so they're the ones who are able to still conquer that silver are starting to grow. So now this will give us something different.
Okay.
Okay? And we may get to a point where we would do this for a week and do silver for a week. You know, we'll just kind
Right,
of see.
just to kind of consider.
Yeah. Yep.
Good,
Okay?
good idea. Thank you,
Always nice
thank
to
you,
see
buddy.
you too.
Appreciate it.
Thank you so much.
Thank you.
Nice
Nice to
meeting
meet you. You're doing an awesome job.
Should we
Thank you.
go to council or would you tell them?
Yeah, I'll do it when I get
Okay,
back.
okay.
Thank you.
Thank you.
Thank you so much.
Okay, thank you. Thank you. Jaco, are you here?
Bye-bye.
Okay, ahorita te alcanzo. Gracias. Bye. Do you want me to take them home?
Yes,
Okay.
you're gonna do one later today.
No, actually,
wait?
I'm gonna do the ABD. Do you wanna come tomorrow so that we can try it?
Yes.
Yeah,
That's what I
okay.
was gonna say,
Mhm.
yeah, that would be, so I think I'm gonna take.
So
care
then
of
I'm just gonna keep him on ABD until tomorrow,
that. Okay,
because we will rip today,
right,
do
and
tomorrow.
they just did the,
Yeah,
okay, yeah,
mhm.
that makes sense.
All right, I think we're free to go, Papa.
Here, take them over.
Okay,
Take them over.
I'll put them on with the rest. Okay, I can start recording right now, right, Papa?
And then after that, what are you doing, belly time or various?
Belly time.
Miserable.
Mm.
Sorry.
Go right
Give
ahead.
me a couple of those.
Well, Audra, can you put it on the record or did you?
Already, Papa.
Sorry.
Thank you.
So, what's the most recent dressings you've been doing?
Say that again?
The most recent dressing stuff?
All of them?
Wound vac dressings, we do 3 times a week. I
Wound vac.
measure once, yeah, Genadine, wound vac. I do the dressing every Friday,
Debbie, you can help her.
and Alejandra does the other 2.
And we had silver loin in there.
We have another opening that we were.
It's closed now.
That's
Mhm.
close, huh?
The one on the
Good.
lateral.
Well done.
Well, those from the side, huh?
Yeah, it did.
Good.
How much vac sponge can you get in there?
You know, my orders originally said not to shove more than like 5 or 6 centimeters in there, but it goes, you know, between 6 centimeters and 9 centimeters, between 6 and 8, depending on his position.
But lately it's been pushing the tail out
You know
because
what,
there's not a lot of space.
this is better than it was
I
before,
thought so.
Yeah.
in terms of how undermined it is.
It's been a year though.
Because I recall it being undermined like my whole hand, and now there's just a tunnel.
Mhm.